Good afternoon, everyone. I'm Reg Helwer, the Minister of Central Services and MLA for Brandon West. Thank you for joining us here today. I'd like to take a moment to acknowledge that we are gathered here today on Treaty 1 territory in the homeland of the Métis Nation. I'd also like to thank PCL Construction staff for their hosting us here today. Pleased to participate in a site tour with the Minister, and we're very impressed with the quality of the work that we saw and the level of expertise that you do bring to your process, to your projects. I know our department and the Minister Friesen's department worked on this very quickly, and at one time I think about at least half the staff were working from home with the new policies we have in place. I imagine you had much the same with collaboration from all across the country. With that said, I now call on our first speaker this afternoon, the Honourable Cameron Friesen, Minister of Health, Seniors and Active Living. Sir?
Thank you, Reg. Good afternoon, everyone. It's a pleasure to be here with all of you to make a very important announcement. Bon après-midi tout le monde. C'est un plaisir d'être ici aujourd'hui pour cette annonce importante. Avec mon collègue ministre Reg Helwer, ministre pour les services centralisés. We are now in our 7th month of dealing with COVID-19 in Manitoba. It has affected everyone. There is no one whose life is untouched in some significant way from a global pandemic. None of us knew in January what this last half of a year would have looked like. None of us could have foreseen the incredible ways, the normal ways we go about our lives would have been abbreviated and changed and amended. And our government has been there and done everything in our power to respond, to mitigate, to work in partnerships in this jurisdiction externally with provinces, territories, and the federal government, with external sources, with the Centre for Disease Control, with the World Health Organization, the Special Advisory Council for the pandemic here in Canada. This has been a team effort. As Dr. Brent Rusin so loves to say, we are in this together. And we're learning as we go. And there have been incredible impacts, and we are still understanding what some of those are. But let us be clear, it has been exceptionally challenging in COVID-19 to consider the impact on personal care homes. All Manitobans, all Canadians were devastated to become aware that there were over 7,000 COVID-19 related deaths in long-term care facilities in Ontario and Quebec. I'll just reflect on one today, Pinecrest Nursing Home in Bobcaygeon, Ontario. Many of you will have never heard of this nursing home. 33 cases, 29 deaths, 32 staff cases. Incredible impact due to this virus and what we were learning at the time. Manitobans recently received a reminder of the risks of COVID-19 with the recent increase in cases in our personal care homes. And I would want to extend sympathies to the families who are currently coping with loss, especially I'm thinking of Bethesda Personal Care Home today in the city of Steinbach. Residents in these homes are often the most vulnerable to the virus, and we've taken steps to limit the impact. I would reflect on just a few things today. We took enormous efforts to try to limit workers in personal care homes. We realized that just historically we had some workers who worked in multiple personal care homes. An incredible undertaking behind the scenes, reliance on hardware and software and algorithms to be able to guide the ability to place a personal care home worker in only one facility. At some points we were told it could not be done. But with partnership from the personal care homes and from the regional health authorities and many other partners, we made it work. And we believe that that one policy alone has saved lives. Thank you to everyone who was involved in that. We curtailed visits in personal care homes early on during the pandemic because we were following advice and because it was necessary. But we were also one of the first provinces to restore visits. First outside, which wasn't always ideal. Spring in Manitoba doesn't always permit for great visiting exterior conditions, but we did it. And families were appreciative. And then shortly thereafter, the next phase, we extended to inside. Yes, you had to be well, and yes, you had to use PPE and wash your hands and answer a questionnaire and go directly to the room of the resident and not dawdle in the hallways. But people caught on, and they were appreciative because those loved ones had been sequestered for a long time. And we were humbled to be able to work with those same partners to reconstitute those visitation privileges. And then, only recently, we allowed a new change that allowed for the designation of 2 family members to be caregivers and to have unfettered visitation privileges. And we've continued to receive that correspondence in our office to say thank you. This makes a difference in our lives. I would also want to just quickly flag the virtual tariffs. These virtual visit tariffs that allow now for personal care home residents to be seen by their doctor without a physical visit. And this has helped to curtail the spread of the virus in facilities. It has helped to get residents to their doctors and doctors to their patients. And we're pleased to be able to have provided that framework. But simply avoiding the virus does not provide residents a sustainable lifestyle. A balance has to be maintained for all residents, physical safety and mental well-being. And Jerry Price and I, give us a wave, Jerry from Price Industries. We were just talking at the back of this area, and he said as well, he said, you can't simply attend to the physical safety of someone in a residence and then pretend it's well, because it's been a critical need to extend that ability to visit. And so allowing personal care home residents to safely maintain those connections they have with family, with friends during COVID-19 is central to their ongoing health and well-being. And so, earlier this summer, our government put out a call for proposals with an audacious idea that we could propose to build outdoor all-season shelters that would be connected to personal care homes and that would avoid the need to curtail visitation altogether in the event of a second wave of COVID-19. Today, I am proud to announce the successful award of that tender to PCL Construction for the development and the construction and the deployment of those shelters, allowing the residents of personal care homes in Manitoba to safely visit with their loved ones.
Aujourd'hui, je suis fier d'annoncer l'attribution de l'appel d'offres à PCL Construction pour le développement et la construction des abris extérieurs qui permettront aux résidents à visiter en toute sécurité leurs proches.
These shelters are going to be built right here on this lot and then moved into place at personal care homes across the province. The shelters were developed with the feedback and input of Manitobans. So Minister Helwer and I and others, Charles Gagné as well, had a chance just to visit and see these shelters, and work will continue here, and then those spaces will be deployed to allow visitors to come in through one point and allow their guests or allow residents to come through the other, to meet in the middle and to have contact, to visit, to make life more normal, even at a time when life is anything but normal. Hundreds of people went to our engagemb.ca website to weigh in on the conceptual designs, and you can see behind me the result of that. Today was emotional for Minister Helwer and I because we've really only seen this on paper. We've seen spec sheets, we've seen designs, we've seen things that they put through the photocopier and showed us, but today we're on this site working with our partners, PCL, Price Industries, Ironman Industries in Winkler, Manitoba, so many other partners who have come together, a quintessential Manitoba response to a challenge
and each of us has the courage of our convictions to be working on this project at this time. This is an aggressive timeline. Some would say it's a slightly impossible timeline. It's a procurement process that is focused strongly on delivery. We are so pleased to engage in a partner that has the operational capacity, the know-how, the experience, the workforce, and the moxie to look at a contest like that and say, I think this is something we would like to do. It's made in Manitoba, by Manitobans, for Manitobans. I'm so proud of the ingenuity and resourcefulness of the teams that have assisted. The Department of Health, the Department of Central Services, the regional health authorities, our personal care home operators across Manitoba. I cannot imagine what your thoughts were the first time you heard these ministers describe what we were looking to do. And we are not there yet. And there is risk and there is uncertainty. But one thing is for sure, doing nothing was not an option. Yeah. Thank you to our partners. Encore de plus, je suis connaissant que ces abris donneront aux résidences du foyer de soins personnels la possibilité d'avoir ces réunions avec leurs proches. This is going to make the difference for all those Manitobans who need to have that contact with their families and their friends and their loved ones, no matter what's happening outside of their personal care home. Thank you. I'll turn things back now to Minister Helwer.
Thank you, Minister. It has indeed been an emotional trip for families and their loved ones, and we think that this will help them journey through the next few months or the next couple of years. We'll see how long it takes to get through this process. But as the Minister said, the families will enter from one side and the residents from another, and they'll be able to visit in a shelter that is heated, is cooled, it is sheltered from the climate, and we think that we have a pretty neat solution to that circumstance here during the pandemic. So it was a very competitive procurement process, and after a rigorous evaluation, we're very pleased with the results that we see here today, and PCL's innovative design of the shelters and ongoing innovation for each one. It would be nice to see that it'd be a cookie cutter approach, that they'd be all the same, but personal care homes are all different, so we need some slightly different solutions in each one. The single-use shipping containers will be used as the shell for these completely finished visiting facilities, and each unit, as you said, will have a visiting room with space for one resident and up to 5 visitors. The enclosed link, the attached link, will ensure that the resident is sheltered from the elements when they're traveling from the personal care home into the shelter. The electrical and mechanical systems have been designed to ensure all the shelters are functional year-round, and in keeping with public health guidelines, the systems will be in place to provide regular air changes, and the interior finishes are all designed for easy cleaning. I now invite Charles Gagné, CEO of Actionmarguerite, to speak. Sir?
Thank you very much. Good afternoon, everyone. Actionmarguerite is a personal care home who operates 3 sites in Winnipeg, operated and owned by the Compassion Network, or formerly known by the Catholic Health Corporation of Manitoba. We are clearly benefactors of this initiative from government, and for that we are grateful. Grateful not only for providing us an opportunity to allow our visitors to visit residents in personal care homes, but also to have the foresightedness in understanding what we've never lived before, which is a pandemic. And yes, Minister, you are correct. I was maybe one of the early skeptics of what are we trying to achieve come winter, because we all think this pandemic will be over come the fall and life will go on. In my 20 years as CEO of this organization, where we have about 600 residents facing all phases of illness associated with aging, including dementia and advanced dementia, over 1,000 personnel, we never really stopped. Even though we knew visitation and family member participation was critical to the care we provided, we never really understood the impact it had, and it's only when you take it away that you understand the impact it has, not only on residents, but on staff and on the family members. From the time we imposed visitor restrictions, which we believed in as being the only and one of the major safeguards that we had to put in place, we also knew that visitors were one day having to come back as we needed them. We just didn't know how. We also underestimated how much visitors and families had to remain connected with their loved ones, whether it be at end of life, at time of illness. Simply knowing that mom or dad or grandma is fine was key to our success as an organization. We had no plan during this pandemic on how we were going to reintroduce that, but we need to trust government and trust Dr. Friesen in trying to phase that in, and I think we've been successful so far. We will continue to have bumps in the roads, and we will continue to manage visitation in a very different way. But I have to say that visits in personal care homes will change during this pandemic and even past this pandemic. And the temporary shelters, for which we are getting 4 of, will simply, even though they may be temporary in time, whether that be 1 year, 2 years, we don't know what that window will look like. We also know that they will tell us in the future how visits should occur in personal care homes as we manage cold season, flus. Hopefully we will not have to manage another pandemic after this one, but by all accounts, we know that future pandemics in the future will occur. And how we best get organized, how we best keep residents safe, how we keep our staff safe, and how we keep families connected with their loved ones, especially as we know that the elderly are living their last phases of their lives, and often that human connection is really what they have to go to. And although we can substitute some of that as professionals, healthcare professionals, we can never replace families. So for that, Minister, I want to thank you for the foresightedness in thinking about what the future holds as we continue to manage the pandemic. I also think, and this is where my CEO hat comes in, 90% of what we do is execution. And thank you to not only government, shared health, and the regional health authorities, as well as PCL, as we are anticipating to get some of these shelters soon at some of our sites as the weather is changing. And in fact, as I was leaving, excavation had started at one of my sites, so we're really anticipating to welcome one of these to continue to allow visits to occur as we will be continuing to celebrate Christmas, birthdays, weekly visits with residents and their families. Alors, Ministre, j'aimerais sincèrement vous remercier beaucoup pour d'avoir un peu la sagesse de penser à comment est-ce que les visites auprès des personnes âgées vont se dérouler à compter de l'automne et l'hiver durant cette pandémie. Et nous, on est très fiers à Actionmarguerite de recevoir 4 de ces abris temporaires toute saison. Et ça va permettre de continuer les visites à nos familles durant et même après la pandémie. Alors pour cela, on vous remercie. Thank you very much. I hope it does give you a bit of an insight of the value this has on residents and the value it will have on their families in being able to continue and maintaining relationships with their loved ones despite their health condition and despite the fact that we're managing a very complex period in long-term care that we've called COVID-19 pandemic. Thank you.
Thank you, Charles. And I know that you and your staff were the recipients of many, many emotional calls from families. As MLAs, Minister Friesen and I received many of those calls as well. And so this is kind of our path through that to find a solution, and I think we found a good solution with a great partner. Our final speaker this afternoon is Monique Buckberger, and Monique is the District Manager for PCL Constructors Canada, responsible for buildings, civil, and special projects operations in Manitoba and Northwestern Ontario. Sorry about that. Northwestern Ontario. Monique?
Thank you. I would like to acknowledge that we are gathered on Treaty 1 territory, as well as the homeland of the Métis people. Honorable Cam Friesen, Honorable Reg Helwer, and invited guests and media. PCL is honored for you to be here with us today to kick off this venture that will improve the lives of Manitobans. The inability of family members to visit loved ones staying in long-term care facilities has been a cause of significant anxiety for many of us. Today, Manitoba is taking a leadership role in addressing this important problem by being the first government to take tangible action to breaking down the barriers that have prevented families from being reunited during this pandemic. And we at PCL are excited to be helping the government achieve this solution. Once the problems resulting from the pandemic began to manifest themselves, PCL began thinking of ways in which we could put our manufacturing expertise and resources across North America to work to provide solutions. We knew it would take an infusion of entrepreneurial spirit to address these problems effectively. That's why we are thrilled with our strategic partnership with Citizen CarePod Corporation and WZMH Architects, who have worked with our local team to design and build the pods you see here today. We could not have gotten to this point without our valued partners. Thank you to Stantec, Wiscan Electrical and Mechanical Services, Thor Mechanical, Price Industries, Pellers Ventilation, Apollo Engineering, Tower Engineering, GDI Drywall, Antex Western, Ironman Industries, and Dortech Manufacturing. These pods being manufactured here in Manitoba by local companies. The visitation pods are being put into use in Manitoba will provide a safe, comfortable environment to allow visits for family and friends to visit the residents of the care facilities. These pods are repurposed, single-use, 40-foot shipping containers retrofitted to address the issues posed by COVID-19. They are fully insulated, heated, air-conditioned, and incorporate a germicidal UVC lighting system. The standard 40-foot long module is equipped with one visitation room that includes separate entrances and exits for both visitors and residents. PCL is looking forward to getting these visitation pods to the long-term care facilities so that they can be put into use and reunite families. Thank you.
Thank you, Monique. We look forward to continuing to work with PCL and your partners. You had a great list there of Manitoba companies as we create these safe shelters for personal care homes. It is quite something to walk through there and see the solution that you've come up with. I can't imagine what you thought when you first saw what we were talking about, but you certainly made it work. So that concludes the formal portion of today's announcement. Thank you to the media and everyone for joining us at today's very important announcement, and the speakers will now be available to answer media questions at the podium here. What was the number you ended up with?
Yeah. Okay, so I believe that this contract is going to see 90 of these shelters built. The procurement exercise itself heavily measured the ability of the proponent to not only build but deploy on time. I think you heard one of our speakers say that we're expecting to start delivery in a matter of weeks, and we hope to have all of these delivered by late fall. Right, that's an excellent question. How will they be cleaned? Often and thoroughly, but also, as Monique said, these shelters are designed with a UVC technology. That's only part of the way they'll be cleaned. They'll be cleaned in intervals between each of the visits. So obviously, when we went out and solicited from the market, we said cleanable surfaces, smooth surfaces, to make it easy to clean. And also, that's probably a good segue to make the point that this is an exercise from government in uploading solutions. It's not an exercise in downloading cost to personal care home operators. So we've tried to make it very, very clear that there's obviously going to be some operational costs that come along associated with these things. There's going to be porters who are needed to take residents to these shelters and back. There's going to be people needed to clean these things. There will be other maintenance issues that happen, and those costs will be covered by the province as well. How do we think the residents will enjoy them? We really hope they do. We were so excited to see visitation being reconstituted this spring. But the enjoyment we had in that paled in comparison by the anecdotal evidence we had by families who said, I've seen my mom again, I've seen my dad or my uncle or aunt. So we know that this could make the difference. And I said earlier, we have talked to other jurisdictions. We are unaware of solutions like this in other jurisdictions. The federal minister is very interested in what Manitoba has proposed and done here, and I know that other provinces will be taking interest in what they see today. So we've got invested here today for these exterior shelters approximately $18 million, $17.9 million, and of course on top of that there will be operational costs. Keep in mind as well that it's not just to create the container, but we have to marshal those resources to site, we have to link them to the facility. All those things are contained. I would make this point. In addition to the 90 shelters that we're building, having taken these orders from the personal care homes, we're also advancing with a separate but related initiative to build interior spaces. And those interior spaces, probably another 40 or 50 more. I think I've heard a number as high as 56 more. So we have a series here of solutions that are being deployed, interior and exterior, based on the needs of the facilities.
I think the answer will be once we get out there in minus 30 or 40, but from what we've seen in there today, a very well designed heating and cooling system that perhaps Monique you can speak to a little bit more, but all in one package. And I think as you walk through there, you'll see it's a very inviting area that again we can clean and sanitize and make sure that everybody's kept safe. Do you want to give some details?
Absolutely. So we've got a heating and cooling system right within the visitation area itself. Is a what's it called? No, the HVAC system draws in fresh air from the care home side or the care facility side, and it's a laminar flow, so it goes all the way through the facility in one direction, so that there's no contaminated air that goes back into the facility. The air gets drawn out through the visitation side so that the resident sits on the fresh air side and flow goes past their visitors. There's both adequate heating and cooling both in the visitation pod itself as well as the link connecting the pod to the facility. No, it's an open area right now.
Right. So the question was about how many of these are going out, because we have 127 personal care homes. It's my understanding, and Minister Helwer will correct me if I'm wrong, I've asked this question a number of times, and we're understanding that there are solutions being employed at every single personal care home. I don't think we had any personal care homes who declined. We were careful to convey the knowledge, as Charles said before, that something would be needed. And so we tried to effectively involve and canvass the operators to know what their needs were. We did site assessments. Central Services and the department with the regions worked very hard to understand the needs of facilities. In some cases, we'll have interior, exterior shelters both. In other ones, like as in Actionmarguerite, we've got multiple units outside. But I think in every case there is some form of solution being employed.
So that would be for the internal rooms that we're building, that we want to make sure that we are able to meet code. We're working with the municipalities, the Office of Fire Commissioner, to make sure that those solutions internal to the PCHs will be very safe. Your question about the barriers, it does not have a barrier here currently, but there are specifications that should COVID go in a unanticipated direction, that we can put barriers in there so we can still have the visit happen within that enclosed space, but keeping the residents safe. That depends on the particular care home. It is not a cookie cutter situation for each and every one. As you go through them, you'll see some have side entrances and some have end entrances. And depending on where that connection is from the home, what the distance will be. You also have elevation changes that we have to work with. So it's a unique environment for each particular care home. Well, we'll make sure that they're safe at that temperature, but the connection will be heated to the personal care home. The entrance for the visitors will be from the outside, so we anticipate that they will be used throughout the winter.
Right. So the question is about mental health in Manitoba and whether we've seen an uptick of the need for that. Yeah, and we were proud to be the first province to actually sign for free of charge internet-based CBT therapy, and the ability for people who are experiencing anxiety and other issues because of the global pandemic to be able to get someone to talk to get into some therapeutic arrangement. And we have seen an increase. I won't know off the top of my head how many Manitobans have now signed up for the ICBT therapy that we are offering through Morneau Chapelle, but I can tell you that number has been steadily growing. We're pleased to see that service is available to those Manitobans who require it. It comes back to that statement I began with to say, none of us are untouched by this. There is the challenges of COVID-19 that we can see, and they're tangible in our everyday lives, but the mental health issues and challenges, anxiety, is no less real, even though it is more invisible. Yeah, I think that all Canadian systems are learning right now about how robust their systems are. Obviously, we need mental health and addiction services available for Manitoba and for Manitobans who need them. That's why we've been pleased to be making millions of dollars in investments, even in the last 12 months. New investments for mental health and addictions at Health Sciences Centre here in Winnipeg, in communities across the province. We have some great new programs that we have just commenced more recently that are bringing those programs closer to people where they live. We were very pleased to be able to sign with Strongest Families Institute about a year and a half ago to bring online new digital-based and internet-based mental health services specifically designed for younger people. And those services are designed to be able to make that connection sooner. And we know what the Virgo report said about the need to better both coordinate those services, but to make sure that we are engaging in investments that come for earlier help instead of waiting for mental health issues to get worse before we respond.
These containers are designed for, their purpose is for shipping containers. Are you referring to our quarantine pods? Oh, yes. So we did have a previous version of use for shipping containers, and it was used for quarantining patients, particularly in locations that don't have quarters available for quarantining. These were very, very early days when we had put together some ideas that we thought might be valuable to locations that didn't have the facilities available. Some of those were, and as well as many others. And Sheriff Health and the government of Manitoba had very specific expectations to what is in the containers themselves. So it's an amalgamation of some of those original thoughts with the pod that you're going to see as a mock-up here later today.
Sure. The reaction from our families and our residents, quite honestly, will be all over the place. I think, like any other environment, some of our families and residents want to go back to what it was. Understanding the risk when you're managing a community of workers, visitors, families, sometimes may not necessarily be adjacent to family values in terms of I want to see mom. So I think we'll get some mixed reactions from this is great. It allows us to continue to visit. It substitutes very well the inclement weather that we've been facing with our outdoor visits and our scheduled visits. And that I think will be reassuring for families. Some will be very supportive of the initiative and some will want to I think, go back to the old days. But what I think it's going to allow us to do is it's going to allow to have families maintain connections with their loved ones. And one of the things that I shouldn't share with you, but I will for the matter, is I have one of my mother-in-law, I only have one, who lives in one of my homes. And during the visitation restrictions, my wife kept reminding me that every day she doesn't get to see her is the less she has with her mother. And when we put ourselves in that position and understanding the pandemic, and of course my wife was very supportive in terms of what we were trying to do, does hit reality. And I think politicians, ministers hear it in a very crude way sometimes from families in terms of the impact, and they have the courage to move that ahead. I think it needs to be noted. My skepticism at first is, think about this, 125 personal care homes within a period of time, we're going to do what? And they're going to be installed by when? And this is really doable was, I think, something that I think needed some convincing. It was important throughout this, however, is to always go back to the why. So as much as we talk about shelters and we talk about the ventilation, we kept reminding ourselves, why are we doing this? Well, because we're living in a pandemic, we want to keep people safe, we want to keep families together, and what's the option? And if this pandemic goes worse in the second wave, the option I would hope would never to go back what we lived in March in terms of visit restrictions, but find an alternative. And I think now we have an alternative that hopefully will find that right balance between managing risk and safety. So I'm converted by virtue of we know that the numbers are going up. And we know that cases in personal care homes will continue to be issues, and therefore I think we will see this 2-3 months from now as being something that, thank God, we thought about this whenever the minister and government thought about this was a good idea.
So the question was, is there a threshold for when the heating and cooling conditions will be functional? And the way that they're designed and specified is that they would accommodate both the heating and the cooling required in a traditional Manitoba summer or winter. No, well, minus 40 to plus 40. There's 2 levels of heating, one right in the visitation area itself, and another that tempers the air passing through. So heating is addressed, and we have an air conditioning system that's attached right into the pod itself.
I don't know if Actionmarguerite's getting the very first one. I have heard that the delivery of the first pod may very well be to a Winnipeg location, so maybe PCL officials could confirm that later on. They do take up a lot of room, and they're being established. There's been very significant assessment of site conditions because, as you can imagine, these are going to take up some space. There's issues of elevation. There's issues of access to existing doors. There's a lot of considerations that go into establishing them, and so I can't say enough about those teams who have done that assessment. And it's one thing to see these things being, converted. Charles isn't the only one who's being converted. So are these 40-foot shipping containers getting converted. But it's one thing to see them built here, but then they still have to be shipped out, unloaded, put on that site. And I can tell you that there's another set of professionals over in those buildings that are working on how to do that. And some of these partners that are here today are fixed on the challenge of making sure this works when they get to site. Yeah, I just want to say another word about that. We were very careful to write the contest in such a way, the procurement exercise in such a way as to additionally measure operational capacity of the proponent, the ability to deliver on the timeline that we said. These will not help us if they start to be delivered in March. And that is why PCL was able to marshal the workforce and produce a solution that gave the government confidence and our system leaders that these could start to be delivered now and make it by the timeline we have described. I think that at capacity, we're going to have, I believe, about 30 of these units on site at a time as they continue to filter through to delivery. Thanks everyone for coming.